5 rights of medication preparation and administration. Five rights. 1. Right person. 2. Right medication. 3. Right time. 4. Right route. 5. Right dose. 1. Right person. When it is time to administer medication, make sure that you know that you have the correct individual in which to administer the medication. If you are not sure if you have the correct person, ask them their name. Better yet, ask another staff member to point out or introduce you to the individual. Once you have the correct individual, you can proceed to administer the medication. 2. Right medication. When it is time to prepare the medication, follow the following steps. Clean your hands and work area. Perform the first check. Before you remove the medication from the med cabinet, check the medication label against the medication record. Remove the medication and perform the second check. Compare the label on the medication to the medication record. Prepare the medication to be administered and perform the third check. Compare the label on the medication to the medication record. You now can safely administer the medication. Dispose of the cup, gloves, wash your hands and then record the administering of the medication onto the medication record. 3. Right time. When you arrive to work, make sure you check to see who will be receiving medications and what time they are scheduled to receive it on your shift. When the time arrives, verify once again by looking at the medication record that they are to receive the medication at that time. You should pass the medication at the time indicated. However, you may administer the medication 30 minutes before or 30 minutes after. If you fail to administer the medications 30 minutes after the scheduled time, make sure to refer to the missed medication standing orders to see if you can safely administer it. If you have any doubt or questions, contact the nurse for assistance. 4. Right route. Make sure you administer the medication using the right route. Major routes. 1. Oral. 2. Injectable. Additional training and approval by a licensed health care provider or his/her designer is required before you can provide injections. 3. Topical. Apply directly to tissue or organ. Example, eye, ear, nose, skin. 4. Rectal. 5. Vaginal. Oral routes. 1. Capsules are made from gelatin. The medicine is placed in the capsule which readily dissolve in the stomach. 2. Tablets are pressed or molded preparations of powdered drugs. When exposed to liquid they expand and break apart. The tablet may have a coating. 3. Elixirs are liquid preparations of drugs. Never crush or open capsules without first consulting a pharmacist. Injectable routes. Injectable. Additional training and approval by a licensed health care provider or his/her designee is required before you can provide injections. Topical routes. Ointments, creams are intended for external application to the skin or mucous membranes. Rectal and vaginal routes. Suppositories are drugs for insertion into the rectum or vagina. The suppository will dissolve or melt at body temperature, releasing the drug for absorption through the mucous membranes. 5. Right dose. You should pass the medication at the time indicated. However, you may administer the medication 30 minutes before or 30 minutes after. If you fail to administer the medications 30 minutes after the scheduled time, Make sure to refer to the missed medication standing orders to see if you can safely administer it. If you have any doubt or questions, contact the nurse for assistance. If you encounter a dosage that you are not familiar with, consult your pharmacist or nurse for safe administration. Medication errors. A medication error has occurred when 1. The wrong person was given a medication. 2. The wrong medication was given to a person. 3. The wrong dosage was given to a person. 4. A medication was administered at the wrong time to a person, or a medication was not administered at all. 5. The medication dosage was incorrectly administered, either too much or too little. 6. A medication was administered using the wrong route. Every medication error is potentially serious and could be life-threatening. The error must be reported immediately and the necessary action taken. Depending on the medication error, you may need to call 911, poison control, the individual's doctor, nurse or the pharmacist to make sure the individual receives immediate medical care if your administration of the medication has caused harm or is life-threatening. Reporting consists of completing an incident report, making an entry into the HCC, Healthcare Chronological, and filing a recipient rights complaint on the behalf of the individual receiving the medication. One. Right person. 2. Right medication. 5 rights. 3. Right time. 4. Right route. 5. Right dose. If any of the 5 rights are violated, complete an incident report, document in the Healthcare Chronicle and file a recipient rights complaint. Every medication error is potentially serious and could be life-threatening. The error must be reported immediately and the necessary action taken.